Good morning. Can you believe it? We have already reached the final day of the World Congress. We encourage you to maximize your time today in the exhibit hall, through the educational sessions, and during networking opportunities with attendees and exhibitors. Today's general session theme concentrates on metabolism, and we hope to address the complex disorder of metabolic syndrome from a variety of perspectives and viewpoints, including the nutritionist, biohacker, precisionist, and engineer. We encourage you to not only discuss the topic with your peers, but also participate in our question and answer panel after the lectures and keynote. This morning's first lecture begins with one of A4M's favorite faculty members, Dr. Pamela Smith. Dr. Smith spent the first 2 decades of her career as an emergency room physician with the Detroit Medical Center, before transitioning to practice for 19 years as an anti-aging, functional medicine specialist. She is a diplomat of the board of the American Academy of Anti-Aging Physicians and an internationally recognized lecturer, author, and media contributor on the subject of metabolic medicine. Dr. Smith additionally holds a master's degree in public health, along with a master's degree in metabolic and nutritional medicine. Welcome, Dr. Smith.
Good morning, everybody. I hope you're all doing well this morning. Oh, I love it. Awesome. Perfect. We're going to spend the next half an hour or so looking at the idea of insulin resistance and its role in weight gain. In saying that, insulin resistance in diabetes is a key component to the patient's overall health. It's not just weight. The patient's blood sugar and fasting insulin are not perfect. There's an increased risk in heart disease. There's also an increased risk in cognitive decline. So it's all about vision, memory, and mobility. Do we want our patients to be the weight they should be? Of course. And I razz people that I weigh 5 more pounds now than I did when I was younger on purpose, because then wrinkles don't show. Because on my next birthday, I will be 65. So sometimes you put on just a little so it keeps you more youthful looking, but it's not supposed to be 40 pounds. More than 80% of the population in the United States that are adults have glucose levels that are too high. So what causes elevated insulin? Certainly eating the wrong foods, too many bad carbs. Stress is really a key component. In fact, I can't think of any medical illness that is not caused by or made worse with stress. Excessive caffeine intake, abuse of alcohol, nicotine, excessive dieting, oral contraceptives, lack of exercise, hormones that are not balanced, insomnia, increased DHEA, hypothyroidism. Remember, the thyroid is the conductor of the hormonal symphony. Excessive progesterone. When you have looking at the actual fasting insulin, you can have something that we call insulin resistance. This is when the body does not respond to insulin normally. I like to call this insulin impotence. So what are some of the symptoms? Acne, ankle swelling, burning feet, constipation. Now, that patient you just can't fix that's constipated and you've looked at their gut and other things, try looking at their blood sugar. Decreased memory, depression, fatigue, blood pressure that goes up and down, fuzzy brain, infertility, irregular menstrual cycles, that irritable patient, loose bowel movements that alternate with constipation, water retention, and, of course, weight gain. So you do want to measure fasting insulin. Most doctors don't. In fact, we are the only field of medicine that actually measures the hormone itself. So when you look at treatment therapies for insulin resistance and diabetes, it's important to start with exercise. How many of you like to exercise? Raise your hand. Be honest. Oh, good for you. I hate it. I exercise for one reason only, and that is to maintain memory. But I really don't like exercising. I do love to dance, however. Okay? That is exercising. There are many ways to do it if your patient doesn't like to exercise like me. Getting enough sleep is key. How I got into anti-aging medicine, because I have been here from the very first conference, was that I had insomnia that no one could fix. I went to 11 doctors and they told me to take a sleeping pill. Well, that didn't fix the cause of my problem. I was very fortunate to come to A4M, and I realized that my reason for insomnia was lack of progesterone. If your patient is not sleeping, it's really difficult for their blood sugar to stay normal. Of course, a healthy eating program is key. High fructose corn syrup is really, really hard on the patient's blood sugar. Looking at nutritional supplements are very important. We don't usually give additional nutrients during pregnancy. And looking at botanicals are key as well. And again, we usually don't do those during pregnancy. Here are two great review articles. So let's start with exercise. Lack of exercise is a risk factor for the development of diabetes in susceptible patients. So in other words, genetic predisposition. And I would love to see every patient at 25 years of age, because you could measure their perfect hormone levels, you could look at their gene pool, and see their genetic predisposition. People don't have to turn on the gene to become diabetic. But once they turn it on, we need to help them. How much exercise does someone need? About 4 hours a week. What is exercise? Doubling your pulse for 20 minutes. If your patient is a couch potato and they're over the age of 45, then make sure they have a stress test before they start an exercise program. Patients should get at least 6.5 hours of sleep a night. I usually don't when I'm here in Vegas, but I live in the Eastern time zone, and what I have learned to do when I'm here is I stay on the Eastern time zone. Vegas is a 24-hour city, right? So my blood sugar and fasting insulin don't fluctuate a whole lot because I get up every day at 4 o'clock here, and I can go get a Starbucks even at 4 o'clock. Diet, low glycemic index, high fiber, good fats. Avocado is a great good fat. Again, avoiding high fructose corn syrup and intermittent caloric restriction may be very beneficial. So when you look at the glycemic index, it's rated 0 to 100. Foods that are high on the list increase blood sugar and can cause insulin to elevate. So this index was first proposed by Dr. David Jenkins at the University of Toronto. So has it been studied? Yes. Look at this from Diabetes Care, all the way back to 1992. Low glycemic index diets in people with type 2 diabetes had better blood sugar control and lower cholesterol. Another study showed that eating a low glycemic index diet was more effective than a diet low in fat, sugar, and calories for weight loss in kids that were obese. Another trial. High glycemic index foods affect neurotransmitter function. So it drives up epinephrine, norepinephrine, and it decreases insulin sensitivity. In this study, insulin secretion over 24 hours was 22% and 42% lower in people who were on low glycemic index programs for only 2 weeks. For only 2 weeks. And the glycemic index is affected by the size of the particles in which the food breaks down into. So let me give you an example of oatmeal. Instant oatmeal would be the worst because it's overprocessed and it's broken down a lot. Then you can take something like non-instant and it's okay, but really the best oatmeal is steel-cut oats because it's less broken down, less processed. In fact, if you go into my own kitchen, I make everything fresh. The only can I have in there, and I have no boxes, the only cannas I have is steel-cut oats. So in my kitchen are pots and pans and medical journals. Probably different than a lot of people's kitchens. But overprocessing is a problem. There is no relationship between the amount of carb in the food and its glycemic index. So the fat content of the food does have an effect. The fat slows down the absorption, and so then it becomes lower on the glycemic index. The protein content also decreases the absorption and consequently decreases the glycemic load. So these are the best carbs that curb insulin. This is from the Sinatra Health Report. Broccoli, lentils, and chickpeas. Wow. Fortunately, I happen to love all of those. Fiber. Are there actual medical studies looking at fiber? Yes. Low fiber intake has been shown in many studies to be a risk factor for the development of diabetes. Fiber has been shown to lower insulin levels. How about good fats? The right balance of saturated to polyunsaturated to monounsaturated fats is important both for prevention and treatment of diabetes. Saturated fats should be less, that should say about 10% of the total calories, and the total fat intake should be less than 30%. High fructose corn syrup is 50% fructose and 50% glucose. High fructose corn syrup can contain up to 80% fructose and 20% glucose. So both sucrose and high fructose corn syrup contain 4 calories per gram. Fructose, when it's processed, is absorbed into the body faster than regular sugar. So fructose is directly absorbed into the body without even a carrier. It goes directly into the cell. Glucose requires insulin to be transported into the cell. And that's the big difference. So when you look at high fructose corn syrup, it leads to an increase in triglyceride synthesis and fat storage in the liver. Do you ever wonder where those patients you have a fatty liver? Take them off of high fructose corn syrup. Fructose does not increase leptin to aid in appetite suppression either. So this may contribute to weight gain. Between 1970 and 1990, the consumption of high fructose corn syrup increased by more than 1,000%. High fructose corn syrup is 40% of the caloric sweeteners added to foods and beverages. And traditionally, people have consumed less than 15 grams of fructose a day from fruits and vegetables. In 1997, consumption on a daily basis had gone to 81 grams. They're not even keeping track anymore. No one is looking at this because the numbers would be startling. If you look at an increased consumption of high fructose corn syrup, it may be literally itself a major contributing factor to the development of metabolic syndrome. High fructose corn syrup consumption contributes to obesity and insulin resistance. In fact, the use of high fructose corn syrup in large quantities may impact the incidence of diabetes. Study done in 2004, the scientists compared the relationship between food consumption of refined carbs and the prevalence of type 2 diabetes. They discovered that during this time, the use of high fructose corn syrup increased by 2,100%. During this same time frame, the rate of diabetes increased greatly. So after controlling for variables, the study revealed that the only decrease in fiber and an increase in high fructose corn syrup were positive correlated with an elevated level of type 2 diabetes. This is from the very conservative American Journal of Clinical Nutrition. Another study. One group was given high glucose diet. The other group was given a high fructose diet. It only took 1 week. Those who ate a high fructose diet had a significant reduction in insulin sensitivity and insulin binding. The group that had the high glucose diet did not experience these changes. In fact, you can measure things. It's quite fascinating. You can take someone and give them a bad meal, one bad meal. They've actually done trials. When they eat that bad meal 2 hours later, you measure their fasting blood sugar, fasting insulin, etc. It's already gone up with one bad meal. This trial showed that men eating a diet of moderate amount of fructose produced adverse changes in glucose metabolization in the normal patients and in people who already had high insulin. How about intermittent fasting? Traditionally, people trying to lose weight have restricted their calories. These types of diets may not be successful due to poor patient compliance. More recent studies have shown that intermittent caloric restriction may be very beneficial for weight loss, insulin dysregulation, and also easier to do. So there are several versions of the caloric restriction diet, and a 5-to-2 being the most popular. So these programs restrict caloric intake on 2 days of the week, most commonly Monday and Thursday, to 500 to 600 calories a day. 5 days of normal eating provides a healthy balance of proteins, carbs, and fats. And the patients lost weight, and they also improved blood sugar and lipids. So this trial was just published. So this is certainly some ways to look at this. There's also other trials that were published recently as well, and more. One study found that intermittent fasting and exercise both proved to be beneficial, but the combined intervention was the most effective in introducing beneficial changes in body weight, body composition, glucose, insulin resistance, and triglycerides in patients that were overweight and obese. One study showed that alternative day fasting did not produce a superior adherence, weight loss, weight maintenance, or cardioprotection versus daily caloric restriction, like to present the balance in the medical literature. But intermittent fasting has been shown to improve gut flora. In order for a patient to be healthy, they have to have a healthy gut. And for those of you who know me out there, you know my favorite thing in the world to talk about is hormones. But if you ask me, is it more important for the patient to have hormonal balance, or is it more important for them to have a healthy gut? I will tell you, I don't know. The patient is not healthy without both. The GI microbiome is key to weight loss. And this is part of the reason why people Lose weight, gain it. Lose weight, gain it. Because no one ever fixed their gut. If the microbiome is unhealthy, it increases the risk of developing infections, insulin resistance, even diabetes, dyslipidemias, high blood pressure, heart disease, and obesity. I'm going to say this again because no one ever teaches this, okay? That's why we're very groundbreaking here at A4M. The GI microbiome is a key to weight loss. If the microbiome is unhealthy, it increases the risk of infections, insulin resistance, diabetes, dyslipidemias, high blood pressure, heart disease, and obesity. Well, isn't that 80% of chronic disease? So if you don't fix the gut, you really don't help the patient a lot. And studies have shown the importance of the microbiome and its relationship to obesity. Again, a just published trial. Adding a nutritional program that's been shown to benefit intermittent caloric restriction to your practice may be very beneficial. In saying that, the most important meal of the day is breakfast. It is breakfast. The patient produces more insulin in the morning. So if you want them to be healthy, if you want them to lose weight, then make sure that on the days where they have the caloric restriction, they do have some sort of breakfast. Looking at nutritional supplements, is there research? Absolutely. Let's start with chromium. Easy to take, inexpensive. Chromium is needed for carb and lipid metabolization, elevated glucose, insulin, cholesterol, triglycerides, and it decreases HDL. All of those things can happen if you give the patient some chromium. It increases insulin sensitivity. Alpha-lipoic acid. I love alpha-lipoic acid. It's both fat and water soluble. It's a broad-spectrum antioxidant. It's a coenzyme in carb metabolization. It increases the number and activity of GALTs, so it really helps the gut. It slows the development of diabetic neuropathy. It's great for memory. So starting at the age of 50, most people make less carnitine, less alpha-lipoic acid. So very important things for memory and also less CoQ10. Magnesium is another favorite. Remember, calcium excites, magnesium relaxes. And magnesium is an essential cofactor in glucose oxidation. It modulates glucose transport across the cell membranes. Magnesium intake has been inversely associated with decreased inflammatory markers. Every single illness in this entire world is inflammatory in nature. If your patient is overweight, by definition, they are inflamed. Magnesium deficiency is associated with insulin resistance. Vanadium improves insulin sensitivity, 10 to 50 micrograms. Bipolar disorder patients, they may have more of a toxic effect, so make sure that you don't go above the 50. Vitamin D. Low vitamin D levels are associated with insulin resistance and beta cell dysfunction. I find these trials really fascinating. I give a lot of metformin in my practice. Metformin, I give it sometimes for PCOS. The patient's already insulin resistant. We give it for many things. Metformin is great for weight loss if the patient's insulin resistant, but it depletes the body of B vitamins and coenzyme Q10. So if you're going to give the patient metformin, make sure you're giving a multivitamin and or a B complex and at least 100 milligrams a day of CoQ10. In this study, metformin improved insulin sensitivity by 13%. Higher vitamin D status in this study, there was a 60% improvement in insulin sensitivity by helping the patient have an optimal vitamin D level. Another study improved insulin sensitivity 21%. So it still beat a drug. You want the patient to be therapeutic. So in vitamin D from Grant and Garland's work should be 55 to 80. Yes, 47 is normal, but it's not optimal. For memory and prevention of breast cancer in both men and women, vitamin D needs to be 55 to 80. If you're not from North America and you have other units that you use for vitamin D, then please email me at faafm63@yahoo.com, and I'm happy to send you a conversion table. Omega-3 fatty acids. Every patient in my practice is on 3 things, no matter what. They're all on a multivitamin, they're all on fish oil, and they're all on a probiotic. Every single patient. Omega-3s have a beneficial effect on plasma insulin and lipid concentrations in animal studies. CLA, an animal's been shown to normalize impaired glucose tolerance and improve hyperinsulinemia. Biotin. Remember, you don't have to always give a nutrient. Where is biotin made? It's made in the gut. If you fix the gut, people have biotin. But biotin deficiency results in impaired glucose utilization. Got to have biotin for hair and nails as well. Vitamin E. Individuals with low vitamin E levels are more likely to develop non-insulin dependent diabetes. Vitamin E improves glucose tolerance and it reduces glycosylation. L-carnitine is an antioxidant that influences free fatty acids and glucose oxidation. It may improve diabetic neuropathy, but there's a caveat to L-carnitine. Make sure you measure TMAO levels before you give it. Because if people have high TMAO and you give them carnitine, you're going to increase their risk of heart disease. It's all about balance in the body. How about carnosine? This is a nutrient, combination of 2 amino acids, antioxidant, very beneficial for the body, including weight loss. Taurine, an amino acid. The body does need zinc to make taurine. I could sit here and speak for an entire hour on taurine. And it also, as one of its functions, has a very positive effect on insulin sensitivity and glucose control. Lots of studies to show that taurine is beneficial. Human trial, patients were given 1.5 grams of taurine. It helped restore levels. The study on adult diabetics that were given 1.5 grams for 14 days, it also helped with arterial stiffness and the ability of the vasculature to respond to changes in blood flow and blood pressure. Here's another trial, experimental clinical cardiology, supports nerve fiber integrity. I mean, there's a lot of trials on taurine. We could go on and on. Most patients are depleted because stress depletes the body of taurine. Arginine. L-arginine helps insulin sensitivity. Are there botanicals that are helpful? Yes, there are. My personal favorite one on here, and everybody has their personal favorite, is berberine. But we're going to look at these. Some great review articles. Ginseng can be very helpful, but you have to be careful with ginseng because it's stimulatory. So this one I don't use as much if my patient comes in at age 80. But in my younger patients, absolutely, because it's adaptogenic and can help with stress as well. Several studies here, 8-week trial, decrease in fasting glucose and hemoglobin A1C. It can also cause insomnia, so don't have the patients take it just before they go to bed. Fenugreek has a hypoglycemic effect. It also lowers cholesterol and triglycerides. Don't give it to people who are allergic to chickpeas. It can, in some patients, cause diarrhea, flatulence, and dizziness. It does contain a coumarin derivative. Don't give it to people who are on blood thinners. It is higher in fiber. There are possible side effects. It can lower potassium in one study. It may alter what happens with thyroid function. There's your references to that. Great review article. So fenugreek I think it works very well, but it's not one I start with just because it's harder to use. Bitter melon is a tropical fruit. It's also called bitter gourd. It has active components that have a very potent hypoglycemic effect, just like a medication. In this single-blind, placebo-controlled trial, looking at aloe vera, 72 diabetics over 2 weeks showed improved blood glucose control. Nepal, otherwise known as prickly pear cactus, nice trial, contains vitamins B, C, calcium, iron, potassium, and beta-carotene, has a hypoglycemic effect. Later study on 14 healthy subjects and 14 diabetics, a hypoglycemic effect was shown on people that had a blood sugar problem, but not on healthy controls. It may also help with lipids. Gymnema, this is one of my personal favorites. It is called sugar destroying. It lowers blood sugar in people with both type 1 and type 2 diabetes. Some great clinical trials. Here in this trial, they looked at gymnema, a reduction in glycosylated hemoglobin and glycosylated plasma protein levels, as well as lowering lipids. People that use this particular herb may need to decrease their oral medications because there can be an interaction with any of these drugs. The actions may be also of this herb. If the patient's on oral contraceptives, this herb is not going to work as well. If they're smoking marijuana or on any of these drugs, then this herb is probably not for the patient. Cinnamon, cloves, bay leaves, these spices are very good for blood sugar. So have your patients spice up their life. Now, some people, like my husband, he has a hard time with cinnamon. It gives him GI upset. Some people, it has stomatitis. There can be some perioral reactions to spicing up your life. Green tea, absolutely fabulous. Meta-analysis study. It helped with blood sugar and fasting insulin. In this study, possible therapeutic agent for the prevention of diabetes progression. Olive leaf extracts contain olipinin, which has been shown to lower blood sugar. Also very good antioxidant. Animal trials on olive leaf, very effective. In this trial, rats were fed a high glycemic index, high-fat diet, and they got the same thing people do, right? Hypertension, insulin resistance, abdominal fat, cholesterol went up. The animals were also fed olive leaf extract along with the unhealthy diet. The metabolic abnormalities improved or normalized. Human trials, supplementation lowered fasting insulin levels. Coffee, green coffee bean extract has been shown to work like metformin in a medical trial. It lowers after meal glucose surges. And then here, my personal favorite. I love berberine. I started 200 milligrams BID. You can go all the way up to 500 milligrams TID. The limiting effect with berberine is that some people get GI upset. Placebo-controlled trial, 116 patients. It really lowered hemoglobin A1C, lowered blood sugar. Pycnogenol, standardized extract of French maritime pine bark, has been shown to be effective to lower lipids, lower blood sugar, and blood pressure. IV gourd has no known side effects. It's from the cucumber family. 2 studies have shown that IV gourd have a significant lipid-lowering effect. Milk thistle I use a lot of milk thistle for liver health, but it's also been shown to lower blood sugar, hemoglobin A1C, and C-peptide levels. I usually start with 200 milligrams BID. It may be even effective for neuropathy. Artichoke has been shown to be very effective for all these things, including having a hypoglycemic effect. It's counterindicated in people with biliary tree blockage or if they have colic. Devil's Club, 1 to 2 grams TID. In animal trials were great, no human trials yet on this herbal therapy. Even garlic and onions contain sulfur compounds. They have an anti-diabetic property. So I gave you some dosages to look at. Remember, with alpha-lipoic acid, you don't want to go above 600 milligrams because it negatively impacts the conversion of T4 to T3. And of course, we don't start patients on every single one of these, right? Start with 1 or 2 and go from there. So you might want to put the patient on vitamin D and some berberine, for example, and some fish oil. So in summary, insulin resistance plays a very major role in weight gain. The science is now here to help our patients in a very personalized approach, because that's where medicine is in 2018. It's very much all about personalized medicine. And that is what we do here at A4M. I would like to invite all of you, if you have not taken the fellowship or any of our other certification courses, to please become more involved. In taking the fellowship, it's almost like going back to medical school again, because the science has changed that much. Even if you went to medical school 5 years ago, or 10, or 20, or 30, or 40 years. Like our artificial intelligence person here, life has changed. Isn't this cool? But life has changed in medicine as well. So please, if you have any interest, you've got my email. We'd love to see you in the fellowship and our other courses at A4M. Thank you very much.
Thank you, Dr. Smith, for all of the practical applications within that lecture. I thought that my circuitry was complicated, but the metabolic pathways of humans are absolutely astonishing.